Hi, so my name is Hiba, and I'm going to be the pharmacist counseling you today. And I just wanted to go over a few things that'll help to provide you with a better understanding as to what you're going to be paying for when you purchase this medication and how it all ties in with your insurance. So, can you please state your name and date of birth for me?
My name is Sarah Vroan, and my date of birth is June 25th, 1997.
Okay, so I'm pulling up your information right here, and I see that you have Blue Medicare RX Value Plus. Does that sound about right?
Yes.
Okay, so before I go over going into the medications with you, I just wanted to explain some terms that you've probably heard,
Mm-hmm.
but have never fully been explained. So when it comes to insurance, have you heard the terms deductible, premium, and copay before?
Yeah, I've heard them, but I'm not sure what they mean
Okay,
exactly.
so I'll go over those with you. So a deductible is going to be the amount that you pay for healthcare services before your health insurance begins to pay. For example, your health insurance plan has a deductible of $235, and so you're going to be required to pay 100% of the eligible expenses
Mm-hmm.
until the bill reaches a total of $235.
Okay.
So after you reach this $235, the cost is going to be shared with your plan provider, and so then after that, you'll be paying coinsurance. So coinsurance is going to be the shared cost of a healthcare service. So it's going to be a percentage of the amount that we allow to be charged for services. So, for example, when you paid that $235 and you meet your deductible,
Mm-hmm.
the next time you go to the doctor or the emergency room or something like that, your plan is going to share the cost with you. So the plan can pay around 75% to 75 to 80%,
Mm-hmm.
and so that leaves you paying the remainder, like 25 or 20%, depending on how much they're actually paying.
Okay.
And do you have any questions so far?
No, you're
Okay.
doing a good job explaining.
So now we have the copay and premium to go over. So a copay would be the fixed amount that you'd be paying when you receive a healthcare service. So
Mm-hmm.
for your plan, I see here that you have a copay that ranges for from $2 to $35, depending on the service.
Mm-hmm.
And so a premium is going to be the amount that you have to pay for health insurance every month. So your first premium payment is going to go directly to the insurance company. So for example, your plan's monthly premium is $38.20. So you're going to be paying that every month in order to have insurance.
Okay.
So right now, after you've heard all these numbers and
Mm-hmm.
all that, do you think you'll be able to afford your current deductible, premium, and copay?
Yeah, I definitely think I could afford them.
Okay, so do you have any further questions so far?
No, I don't think so. There was one thing
Okay.
I wasn't really sure about. I saw something about the tiers. Like I didn't really know what the tiers and the
Okay.
formulary meant.
Okay, so that's a good question. I mean, so each Medicare drug plan is going to have a list of covered drugs,
Mm-hmm.
and this is going to be known as a formulary. And so Medicare drug plans will then place all their covered drugs that are on their formularies into tiers based on their prices. So most drug tiers are broken down in the following way. So tier one is going to be the preferred generic. Tier two is going to be the generic. Tier three is going to be the preferred brand.
Mm-hmm.
Tier four will be the non-preferred drug, and tier five will be the specialty tier. So those are going to be specialty drugs and all that. And so Medicare uses a 1 to 5 star rating system that measures how well the Medicare Advantage and prescription drug plan are performing. So the 5 star rating is going to be the highest, and the 1 star rating is going to be the lowest.
Okay.
So does that answer your question?
Yeah, it does. Thank you.
Okay, I'm glad. So I see here that your doctor prescribed you the brand Lipitor for 40 milligrams,
Mm-hmm.
and they usually the more common one that is prescribed is the generic atorvastatin, but I see here that it was put in for Lipitor at your request.
Mm-hmm.
So
It's just because I think that the brand works better than
Okay.
the generic for me personally.
Okay, so Actually, the brand Lipitor and the generic atorvastatin, they both have the identical amount and type of active drug ingredient, which in your case is the drug ingredient is actually atorvastatin. So you're taking a 40 milligram tablet, so it's going to have 40 milligrams of active drug ingredient, which is atorvastatin. And the only real difference between these two is going to be the inactive ingredient. So it's going to be all the other stuff that makes up the rest of the tablet.
Okay.
And the thing is that inactive ingredients don't contribute in any way to like any of the therapeutic effects to help lower your cholesterol. So I would actually advise you to get the generic atorvastatin because it's significantly cheaper. Like for your plan right now, I think it's about $3, and the actual drug amount that you'd be paying for Lipitor is $477. And so you're paying that out of pocket, so since your Lipitor is not covered on your formulary.
So they would be doing like the same exact things and like working the same way.
Yeah. So since they both have the same active ingredient, atorvastatin, they both work exactly the same. And the only reason that brand names are usually more expensive than the equivalent generic is because of the high initial cost to develop the drug, since it's going to be the first on the market, and like they have to pay for all the marketing for the brand new drug and like all the testing and all that. So that's the only reason brand name drugs are more expensive.
I think I would like definitely be interested in like switching to the generic then. So.
Okay, well that sounds good to me. I'll get that ready for you, and if you have any questions, please feel free to call me.
Okay, thank you.